Hi, it's Dr. Mark. In this video, we are going to demonstrate a mobility routine that you can use to help support your chiropractic care, or anytime that you may notice some tension build or discomfort in the area of the mid, upper back, or shoulder region. I'm going to show you a few simple mobility and muscle activation techniques that can be performed without any equipment, or a simple rubber tube or a resistance band, or even a towel, a bath towel, work very well. We'll get to those in a moment. I often talk to patients about what we call flexor dominant posture. It's that position we get into when we're driving cars, sitting at desks, working on technology. Shoulders get rolled forward, head comes forward too. You sustain that position through a period of time. It creates a lot of tension build and eventually aches and discomforts between the shoulder blades, that upper back area, and works its way to the shoulders too. So we need to work to reverse these effects and minimize the tension build through our bodies. And with that said, our focus today is the mid, upper back, and shoulder area. We'll start with some mobility. First off, simply doing some arm circles, one at a time, going in the backward direction to really feel that opening up through the chest area and that extension through the pec muscles and full range of motion through the shoulders. I recommend performing 10 on each side. From there, we'll activate the muscles between the shoulder blades. The next exercise I call good mornings. It's a movement you may do when you first get out of bed, and you just do that big stretch to try to release some tension and wake up your body. So it's that squeezing the shoulder blades together, and you can do that again 10 times, slow and controlled. From here, we may go into further muscle activation, doing an exercise called wall angels. Imagine I'm standing up against a wall, heels in contact with the lower portion of the wall. We bring our arms up into somewhat of a T or L position here, and make sure the elbows and hands get back in contact with the wall. This may be challenging for some of you. You may be very tight, locked in through the shoulder pec area. Just work within comfort range to hold that position. From here, we'll maintain that position with movement of the hands upwards and downwards against the wall, doing wall angels. It's going to be challenging. It will take some time for improvement, but be consistent with it, and you'll find that release of tension and that greater range of mobility through the shoulders. If you have a lot of tension or resistance in the shoulders, or some people may be diagnosed with frozen shoulder, we can do wall climbs. So using a wall, contacting the wall and allowing your hand to crawl up the wall into a higher position, using that leverage of the wall and the support of the wall to get into that greater range of motion within relative comfort. So that is wall climbs. From here, going into further activation techniques, specific to the shoulders, again, rubber tubing works very well. You could use a bath towel for that resistance. Essentially, with the elbows tucked in tight to the body, we're going to go into what we call the external range of movement. So external range of movement with resistance, slow, controlled, and just feel those muscles around the outer portion of the shoulder, what we call the external rotators, to engage that movement. Resistance bands are a great tool, again, because you can vary the amount of resistance. You can tighten it up and just feel those muscles working. Again, we're working to reverse the effects of flexor dominant posture, to open up through the shoulders and get things moving better. I like to finish off with what's called child's pose. It's a yoga technique where you're kneeling on the ground. You allow your arms to go over top your head. You can walk them one direction or the other direction and just feel that good opening up through the chest and shoulders. So look to do a Google search or a YouTube on child's pose to direct you through that. Take time to work on these. Be patient. It may be challenging to get into some of the positions. Consistency is key. The rewards will be worth the effort. And as always, feel free to contact us with any questions or further clarification that you may have. We may specifically speak to some of your individual concerns as well and add to some of these basic routines. But be consistent, be well, take care of yourself.